Hey, Andy here this morning. It is March 3rd, and Philadelphia is still recovering from this surprise snowstorm that got us yesterday. It's freezing, and as usual, when it's cold, I'm not real happy about it, being a warm weather fellow myself. Today, we're going to talk a little bit about epidurals. Now, I received two questions, one from an online patient and one from somebody here in my office the other day. And the question was, are epidurals just a band-aid that you use to mask the pain? Well, let's talk a little bit about what an epidural is first. What an anesthesiologist or physical medicine and rehab specialist will do is they'll go in between these spinous processes and put a medium to large bore needle into the sac of fluid that surrounds your spinal cord. And when they get into that sac, what they'll do is that they'll inject some lidocaine, which is a painkiller, and a little bit of a steroid, which is an anti-inflammatory agent. Now, gravity will cause that epidural to float down through that fluid and cause pain relief at the segment that's inflamed. Now, each one of these segments has a nerve coming out. There's an exit foramina, that's a little hole that the nerve comes out of, and that epidural will float down and it'll provide anesthesia at that segment through the lidocaine and an anti-inflammatory through the steroid or the cortisone that they inject there. Now, on the first level, yes, it is a bit of a band-aid and it will provide some pain relief in the immediate sense, but there is actually a long-term benefit that we need to consider when you think about an epidural. Everything that you do has firing patterns. Those are the things that your body does to accomplish different activities. And those are things that happen in the unconscious. Getting in and out of your car, you don't think about the muscles that you use when you're getting in and out of your car. Sitting down in a chair, bending down to pick up your kids, all the things that you do throughout your day require these firing patterns that are these unconscious patterns of nerves firing off to use the muscles that you use to do all those things. Now, when you're in pain, those firing patterns get damaged. You're doing things in an irregular way because you're in pain. So as those firing patterns become damaged, you start to do things in different ways than you normally would. And the long-term effect of that is to cause abnormal wear and tear on different structures in your spine. If you can reduce the pain, and whether that's transiently through the lidocaine or in a longer term with the steroid, what you can do is start to reestablish the more normal firing patterns, and that can go a long way towards giving you long-term pain relief, not just the effects of a Band-Aid. Sometime in the next few weeks, we are going to be talking with a physical medicine and rehab specialist about epidurals and spinal injections, and hopefully he'll give us a little bit more information. And if you have any questions that you'd like to have specifically answered when we speak with him, feel free to submit them. You can submit them here on the blog or through my website or through email at Kirschner, AKIRSCHNER, at backtogether.org. I look forward to your questions, and I thank you for joining me, and I hope the next time you see me it's a couple degrees warmer than it is now. Have a great day.